Well, we'd like to officially welcome everyone to our very first Wellness Wednesdays, a community connection. We're very glad that you're here today. My name is Allison O'Toole, and I'm the Executive Director of Corporate and Community Relations here at the University of Arizona Health Sciences. And I'd like to take a quick second to introduce you to our other two team members. Anne-Marie Medina is our Director of Corporate and Community Relations in Tucson. And then Caroline Berger is our Director of Corporate and Community Relations in Phoenix. And we would love to stay engaged with you. Our email addresses are here. Please feel free to send us a note and let us know how we might be a resource to you. But we're very glad that you're here, and we put a lot of energy and time putting these presentations together, and we really hope that you enjoy them today. So if you're not familiar, we think it's important just to take a moment to let you know that the University of Arizona Health Sciences is a statewide leader in biomedical research and health professions trainings. Health Sciences includes 5 colleges, 2 medical schools, the College of Medicine Tucson and the College of Medicine Phoenix, along with nursing, pharmacy, and of course the Mellon Enid Zuckerman College of Public Health, located in Tucson and then on the Phoenix Biomedical Campus in downtown Phoenix. And from these vantage points, the Health Sciences reaches across the state of Arizona and the greater Southwest to provide cutting-edge health education, research, and community outreach services like Wellness Wednesdays today. As a major economic engine, Health Sciences employs nearly 5,000 people, has about 4,000 students and 900 faculty members, and garners $200 million in research grants and contracts annually. We also want to introduce you to our Senior Vice President of Health Sciences, Dr. Michael Dake, who oversees Health Sciences. And also, I encourage you to keep in touch with us at our website at uahs.arizona.edu, and then of course on all of our social media channels. This is a great way to learn about how our students and clinicians and researchers have pivoted their whole lives and their areas of focus to help contribute to COVID-19. And we'd love for you to keep in touch and even encourage them and send, a note or stay engaged that way. And then also you can find me on Twitter at UAMedGal. And if you're on Twitter today or online, you can also tweet about this experience using the hashtag WellnessWednesdaysAZ. Now, I wanted to share a quick overview for the day. We'll spend the first 15 minutes with Dr. Shad. He'll be giving his presentation, and then we'll spend the remaining time answering all of your questions. So if you'd like, you can leave questions throughout the presentation using the chat function. And at the very end, we will even do our best to see if we can even have you ask questions live via the webinar functions. And you can do that by using the different functions by raising your hand, and then we can call on you to ask your question. Also wanted to bring to your attention real quick, we're going to be sending you a post email. In this email will be an evaluation of the session today, where you can share your tips, your advice, future sessions you'd like to see. And then Dr. Shad will also be referencing different links and resources in his presentation today. So we'll be sending that out to you. So just to be on the lookout for that. And then this session we're actually recording, and we will send you a link to the recording. Feel free to share it on social media and share with your family and friends. Since it is lunchtime, we thought it would be fun to show off real quick what we're going to be eating for lunch, at least in my house. Today, I have put together just a brown rice bowl. These are veggies that were left over from last night with a little smoked salmon and some spinach and cilantro. Now, I'm not trying to show off. Yesterday we had quesadillas and guacamole and chips, but just for today, I thought it would be fun, and this is what I'm going to be munching on during the presentation. And then also wanted to share one of my favorite Instagram people to follow, and this is a plant-based RD, and she offers great tips on how to make really interesting food combinations that will keep you interested in trying to eat healthy. So I just wanted to share that with you today. And now I'd like to introduce you to our presenter today, Dr. Farshad Marvasti. We call him Dr. Shad on campus, so you can too. Dr. Shad is a clinical professor at the University of Arizona College of Medicine, Phoenix. He's also the Director of Public Health, Prevention, and Population Health. He is a Stanford-trained physician, medical educator, public speaker, and aspiring author. So Dr. Shad, we're excited to welcome you today to our very first Wellness Wednesdays.
Great, thank you very much, Allison, and thank you for all of you who are tuning in. As you see there, she's got on the screen. I'm going to go ahead and share my screen. And we'll go ahead and get started. This is an exciting opportunity to be able to present to all of you and engage everyone during this unprecedented time. So today we're going to talk about integrative medicine, optimizing your health with food as medicine more. As Allison just mentioned, I serve as Associate Professor for Family, Community, and Preventive Medicine and the Director of our Public Health Prevention and Health Promotion curriculum, which includes our nutrition curriculum, which you'll find out is less common than you may think in medical schools, although it is important. We'll be sending some follow-up links. You can also connect with me through social media and through my website, which is drshad.com. So we have a few minutes to talk right now, but then we really want to make this interactive. So today we're going to talk a little bit about what is integrative medicine, why is nutrition important in terms of health, and how you can use food as medicine. And then we'll talk a little bit about building your immunity in general and some specific tips in terms of helping to prevent coronavirus infection and optimizing your health. So integrative medicine, as defined by one of my mentors, is Dr. Andrew Weil at the Andrew Weil Center for Integrative Medicine, is a healing-oriented medicine that takes account of the whole person, which is the body, mind, and spirit, and includes all aspects of lifestyle. It emphasizes a therapeutic relationship that makes use of all appropriate therapies, both conventional and alternative. So if you really think about it, integrative medicine encompasses not only components of conventional medicine, such as surgery or pharmaceutical drugs, but it also includes evidence-based, safer options, as well as like herbal medicines, particular diets, as well as our lifestyle and behavior. And we'll talk a little bit more about specifically nutrition and food as medicine today. But this whole series of Wellness Wednesdays actually is going to be able to touch on a lot of different components of integrative medicine in terms of how you can be empowered with the tools to optimize your health. So the principles of integrative medicine, and by the way, the University of Arizona Health Sciences and the Andrew Weil Center for Integrative Medicine is actually a leader in this, and they're just now celebrating their 25th anniversary. I'm actually one of the graduates of the fellowship in integrative medicine, which is a 2-year fellowship for physicians and health professionals, where we study all of the components of these complementary approaches, and these are some of the principles and concepts. So those of us who practice integrative medicine, whatever field we are, we believe in a practitioner and patient partnership between the physician and the patient. We want to use conventional as well as complementary approaches that facilitate the body's innate healing response and look at all the factors that influence health, right? One of the things that I oversee in our curriculum is addressing the social determinants of health. So as integrative medicine, we look at the social, behavioral, and lifestyle determinants of health. Some of the work that I do in a more underserved setting with one of our community partners, Wesley Community Health Center, is putting together with our students visits, group visits and cooking classes for patients with diabetes. And we know how critical that can be. And that's one of my areas of expertise that I work with and the patients that I work with, both in that population and my health coaching practice. And we know that there's all sorts of components to this. And so the key here is it's really the best of both worlds in terms of integrative medicine. You're bringing all of it together. It's recognizing that good science should be based in good medicine should be based in good science and be inquiry driven and open to new paradigms, and also using less invasive, less harmful potential for harm interventions wherever possible, and really focusing more on health prevention, health promotion and prevention, another area that I really focus on and write about, and really talking about this partnership. So as I mentioned, in the next several weeks, and you'll see this on the website for Wellness Wednesdays, a number of components of what is considered to be integrative medicine, addressing all aspects of health, will be discussed. So I encourage all of you to join all of the sessions that are coming up. where you can learn about things like optimistic thinking, tools like guided imagery, as well as connecting with others and things like yoga, which are all very helpful, particularly in this time. So today we're going to talk a little bit about the concept of food as medicine. This concept is an ancient concept. It's been around for millennia. You may know from other traditional cultures and medicines, the concept of yin yang and balance in terms of hot and cold nature of foods. Ayurveda talks about the three doshas related to food and what you should be eating. All sorts of cultures have had this across time. But our current approach is very much focused on pharmaceuticals and medications. And, you know, really our care focuses on acute care. We look at drugs and pharmaceuticals, not really food as first-line treatment. Diet is really considered to be kind of an adjunct in extreme, and not really for extreme cases. We don't really have a focus on prevention. You know, all of our visits, actually two-thirds of all visits to a physician actually end up resulting in a prescription. You may have all experienced that. Now, prescriptions and medications can be life-saving, but there's also a darker side to that as well, which causes us to think about other alternatives. You know, 60% of Americans take at least one prescription drug, yet adverse reactions to drugs have been seen to be as high as the fourth leading cause of death. And in the US, we're about 5% of the population, yet we consume 34% of the world pharmaceuticals. And we pay more for it than any other nation. The next highest payer of pharmaceuticals is Canada, and we're 40% higher than they are. There's all sorts of policy levels there. And you know, for one medication to come to market, it takes anywhere from 10 to 15 years and $300 to $500 million. And you can't really patent something like an herb or a food, right? And so you can see the challenges in our system. So as life-saving and critical as medications can be, we also need to look at other options in terms of treating ourselves. And being more at home these days and having that time to actually invest in our lifestyle makes food a particularly appealing alternative. So how much nutrition education is there? On average, over the 4 years of medical school, there's only 19.6 hours over 4 years. So is that enough? Does it make sense? Maybe nutrition doesn't have anything to do with health. Maybe it doesn't actually make an impact. Well, in fact, when you look at cardiovascular disease, heart disease, a recent review looked at as high as 45.4% of cardiometabolic deaths were really due to suboptimal intake of dietary factors, including excess sodium, insufficient intake of nuts and seeds, which have healthy fats and proteins, and high intake of processed meats, as well as low intake of healthy fats from sources like omega-3 and seafood. And this actually follows, the CDC did a review to look at the impact of all the risk factors, looking at things like your weight, whether you're physically active or not, your smoking status, whether you have high blood pressure or not, whether or not you have high blood sugar, high cholesterol. And when they looked at it, they found that in the state of US health, the #1 risk factor for both disability, adjusted life years, and death are dietary risk factors. So diet is actually very important above a lot of these other risk factors that we may think about, and they actually contribute directly to them. And so there's a disconnect, right, in terms of how much we're learning in medical school about nutrition and how much we're talking about it in healthcare versus how much of an impact it has on people's lives and people's health. And in fact, when you look at our health and our diets, you know, our average vegetable and fruit consumption, you know, most people don't get the amount of fruits and vegetables that you need to get every day. And that's something that's very lamentable and unfortunate. And it's really a big component of what we call the standard American diet, which I'll go into a little bit more. But basically, when you look at our food policy, it's really at odds with a lot of healthy options because of the way the policy is set up. And we're not going to go into it right now, but one of the things that the University of Arizona College of Medicine, Phoenix, we have a culinary medicine program where students are engaged in discourse about this, also educating the public. We started before all of the shutdown, working with Phoenix Public Market, doing cooking classes there on the third Saturday of every month. This past Monday, actually, we did a meeting with the students and State Senator Heather Carter to talk about food policy, food insecurity, and policy, and what impact it has on health. And so we're going to actually be continuing to build on that, and I'm going to be sharing some links to that recording as well as other events and activities we're going to do, so you can also get engaged in learning how to effectively advocate for better policies to change this, to change what we got here, right? Which is the standard American diet, where plant food accounts for a very small percentage of our calories, and a big percentage of our food in our diet comes from processed foods. And we know that that is has a huge negative impact on our health that we're learning more and more about. So what does the standard American diet look like? It's high in bad fats. It's high in high glycemic load, basically refined sugars, refined grains, high in a lot of additives and chemicals, all of these that are connected with the diseases of our time. It's low in anti-inflammatory, anti-thrombotic, omega-3 fatty acids. It's low in plant foods, as well as protective micronutrients that come from nuts and seeds and other plant foods that we should be eating, which we're not eating enough of. And so that's kind of a summary of what it looks like. And very low in fiber, fiber being such a critical component of feeding our microbiome, so a component to lowering our blood pressure, lowering our blood cholesterol, optimizing our weight. All of these factors kind of come into play when you look at the diseases of our time. Incidentally, diabetes, heart disease, and cancer account for 7 out of every 10 deaths and 70% or more of all health expenditures. And so what we really want to look at when you talk about food as medicine is something like the Mediterranean diet, which has been shown to prevent heart disease, both in primary cases as well as secondary. People don't have it, and we can go into detail about that, and there's a lot to talk about there, but there's a lot of evidence there. One of the things that I focus on in my clinical practice, as I mentioned, as well as my health coaching practice, is looking at diabetes and using food as medicine. So folks come in with very uncontrolled diabetes, and we put them in this diet, and we actually use food as medicine, and you can see an impact in as little as 3 months in terms of shifting in terms of the numbers, as you can see, those of you who are familiar with these numbers. A lot of that intervention involves combining complex carbs, good fiber with good fats, things like avocados. Vinegar itself has actually been shown to be effective in lowering blood sugar in multiple mechanisms similar to many medications. So food really can be used as medicine. One note of caution is that when you're cooking, you want to be careful not to get to the smoke point with food, because when you get to the smoke point of that oil, it damages the oil and it causes the formation of trans fats and other free radicals, and it damages the oil, which then causes inflammation, which basically can lead to disease, particularly atherosclerosis and cardiovascular disease. So look at the heat level, for example, of the oil, and then determine what oil you're going to be using in terms of cooking. So I'm going to kind of transition from that to a little bit about what our current crisis is and how we can build immunity and engage in health. So obviously, we can't go very far these days without hearing something about coronavirus or COVID-19. It's a pandemic. It's unprecedented. It's affecting everyone. In my blog article on drshad.com, I talked about how this is an opportunity for us to really recognize how we can really come together in a way that we never have before, no matter what background we're facing as humanity. This is highly infectious. It's virulent. It can cause, as you know, acute respiratory distress syndrome, as well as a cytokine storm, which can be deadly. One of the ways that it works is that it actually binds to ACE2 receptors and it goes into the cells. We're learning every day more and more, and we're all humbled in the medical profession and healthcare profession about how this works. What does it mean? And then as any virus, it basically starts reproducing viral proteins, and then releases this mature virus. And you can read more about that. Really, the best thing we can do right now, and it's, as you can see, we have a lot of resources through the University of Arizona Health Sciences that talk about this. But as you know, it's really that social or really physical distancing, right, to avoid exposure, and then we can just build our immunity. So how can we build our immunity? Just before I kind of talk briefly about this, and we're going to go to questions. I really advise everyone to consult with their physician. You can also consult an integrative medicine physician on the University of Arizona Integrative Medicine website, there are resources for this, and I've drawn upon some of those for this presentation, and you can access those directly. Remember that there's very little clinical evidence about COVID-19 at this time, so we know very little about it. So what we're sharing right now in terms of what you can do to build your immunity is really based on what we know in general about viruses as well as health, and some preclinical evidence that started to being developed, but we have a ways to go. So really the focus should be on the public health measures. So some of the things that you can do to build your immunity, and this is something we finally have a chance to do in a meaningful way because we're trapped at home in a way that we haven't had before. We've got our coworkers with us. A lot of us refer to our family members and kids as coworkers. Is really trying to get adequate sleep, okay? Melatonin levels are one of those things that have actually been seen to potentially be, again, we're starting to learn about this, protective in children. For one of the reasons why they may not be getting the infection as much as adults, obviously, is because of melatonin levels. So getting adequate sleep is actually important. It's not just for the coronavirus, but in general for your health. Taking time to reduce stress, and this Wellness Wednesdays endeavor that we initiated here will give you more tools in terms of how to do that. There's apps that talk about meditation, there's mindfulness, there's many different ways of meditating, and even just taking time, a few minutes to relax a day and reflect is really powerful, as well as just being active, you know, getting up and moving. And now we're all a captive audience, we're talking, we're interacting, but it's a beautiful day, as Allison mentioned today. On the forecast, we should take advantage of that and go outside, even if it's just a few minutes to walk. As well as some of the other general principles is eating real food and eating more plants. Because the phytochemicals, the plant chemicals, are very protective against a host of diseases. So some of the things I advise is to remove unhealthy foods, you know, remove refined sugar as much as possible, limit it, refined grains, hydrogenated oils. These are things that are additives that are a big part of the processed foods that make a big part of the standard American SAD diet. Excess animal products and saturated fat, as well as anything processed I mentioned, and also looking at soda and even diet products. A lot of times people would be surprised to know that the products that say diet or low fat actually are worse for our health in a lot of ways. The low fat products tend to be higher in preservatives and simple sugars that contribute to obesity and diabetes, high blood pressure. The dietary products which have non-nutritive sweeteners like aspartame, for example, has been shown to be toxic to our microbiome and also to increase our risk for diabetes more than regular soda. So for studies where they looked at soda consumption, for example. So I would avoid those products and eat more real food. Also, I can't emphasize enough how important it is to really clear your mind and connect with your heart and be positive and be well and live well. And that, what does that look like? Well, it means taking a break from the 24-hour news cycle, right? It's actually going for a walk. It's doing something that doesn't involve this inundation of information overload, which we always constantly are swimming in. And making a routine every day, right? It's really easy when we have more time to ourselves at home to just kind of become complacent and not have any schedule. But I find that having a schedule actually makes a big difference. And really taking time, even though we're physically distant from each other, to invest in meaningful, authentic relationships. One of the studies that came out of Harvard University a few years back showed that the single biggest contributor, and they looked at thousands of people longitudinally over time, the single biggest contributor to health outcomes was whether or not the people in the study had a meaningful, authentic relationship, and not necessarily their cholesterol level or any other health factors. So eating more phytonutrients in the form of plants, eating real foods, and eating the rainbow of all the different foods, nuts and seeds, using healing spices like garlic, onion, cayenne, ginger, turmeric, cinnamon in foods, eating raw nuts and seeds. These are things that build our immunity. Remember, the microbiome is basically 90% of who we are. And the way to feed that is also having fermented foods like miso, kimchi, sauerkraut, tempeh, yogurt, eating fiber-rich foods, eating prebiotic foods, as well as if you're going to take a probiotic, to have multiple strains. Some specific supplements that we're starting to learn about that contribute to health that we've known about for years in terms of building immunity. These particular ones block ACE2 receptor binding in vitro in some cases that we've seen, and we're learning about whether how much this applies to coronavirus. It's astragalus, quercetin, and vitamin D3, so you can look at your vitamin status there. Also, things that inhibit viral attachment replication, elderberry, zinc. These are things that have been around for a while and help us protect us against cold viruses, other types of coronaviruses, right? The ones that have been around for a long time without major problems. Vitamin D, other ones that kind of reduce the inflammasome activation, which is kind of that cascade that leads to a lot of the negative effects. Of vitamin C, melatonin, which you can either get in the form of sleep, obviously more sleep having that, as well as supplements. Incidentally, pistachios, which are one of my favorite foods, have more melatonin per gram than any other food, so I enjoy snacking on raw pistachios. Garlic, quercetin, green tea, curcumin, turmeric, a lot of things that we may have known about. So I advise you all to consult your doctor, talk about some of these supplements, but these are some of the ones that that I utilize in my practice, as well as I'm advising my patients. And I look forward to hearing your questions, continuing to stay engaged with you through this, as well as other opportunities to connect through other events and activities we'll be doing. I'm also available for consultations with folks as well. Now we're all doing everything virtually. So with that, I'm going to go ahead and stop sharing my screen and turn it over to Allison to help connect with folks in the question.
Yes, thank you so much. And I know we went through that really quickly, which is why we wanted to record this session so you can go back and make notes. But I can tell you that I heard this presentation a couple years ago, and I have diligently tried to shift and change how I eat, and I've never felt better. And I promise I'm going to stop drinking Diet Dr. Pepper. You reminded me of that today, so thank you for that little nudge on the side. So I'm going to read through a couple questions that we have for you. We'll try to get through as many as we can. Since obesity is a prevalent problem in America, why isn't there more education about the dangers of becoming obese? Thank you, Carolyn, for that question.
It's a great question. I think what's happened over the last several decades, we show charts in medical school when I teach the students that show the big jump, right, in the numbers. And it's gotten to the point that, you know, now the latest numbers, I think if you look at overweight plus obese, it's nearly 70% of the US population. The obesity percentage is in the 30s, you know, 30-something% of the United States are obese. So it's becoming something that's more normalized and people are more accustomed to. And obviously the last thing we want to do is negatively stigmatize anyone who has this. And you know that kids who are overweight or obese are you know, at risk for being bullied. And we know it's a negative stigma as well. So we want to find a way to address this in a way that is sensitive to that, as well as recognizing that it is a public health hazard and a lot of people are affected by it. And so I think those are some of the factors that we have to take into consideration. Years ago, the World Health Organization categorized obesity itself as a disease. You have worse outcomes for pretty much almost every major medical condition if you are obese or overweight. And when you lose weight, you know, for example, people with certain types of breast cancer, if you have breast cancer and you're overweight when you're diagnosed, and then you lose weight, you reduce your chances of getting recurrence of breast cancer by a significant percentage. So it's a big thing, and people need to be educated on how to do that, but they need to be empowered positively. And so I always try to discuss that in that way, in that light with my students, as well as with my patients who are challenged with obesity.
Right. Yeah, that was a great question. Thank you, Carolyn, for sending that question. Another question from Barry is, tell us the role of soy-based additives in a diet of a person that's surviving breast cancer. You know, that's sometimes a concern for.
So it depends on what type of breast cancer you have. So there's hormone receptor positive, and then there's hormone receptor negative. There's double positive, triple positive, receptor positive. So I would advise that you consult with your physician about what type of breast cancer you have, because there's some of them that make that it makes a bigger impact, some makes a lesser impact. In general, it doesn't make as much of an impact as we might think, because when sure, soy has phytoestrogens in it, right? Plant-based estrogens, but we don't know exactly how they work. they have about 1/1000th of the affinity for the estrogen receptor than estrogen would have normally, or if you're taking exogenous estrogens. So just having it in your diet probably doesn't make as much of an impact, but it can make actually a positive impact. We find longitudinally in epidemiology studies when people are exposed to soy from childhood and throughout their life, as opposed to adding it. And now obviously there's been some studies looking at postmenopausal symptoms in soy. And again, that varies from person to person. So it's really not like a one size fits all, and it's probably not as big of an impact. The biggest thing I would advise is people being wary of a lot of the anti-aging claims of being on hormones or estrogen pellets and things like that, and really being careful about that, because that has much more of an impact than incorporating soy into your diet.
Great, good question. We have a question from Nicole asking about the role of probiotics in the immune system. The last few times I took the kids to the pediatrician or even my own doctor, they are now really encouraging probiotics. So might be interested to have you touch base on that.
Absolutely. The best way to get a lot of the bacteria, as I mentioned, the microbiome, we could have a whole session on microbiome, and I give talks on the microbiome all the time. It's really important. The best is really to get it in the form of fermented foods as much as you can. We live in an over-sanitized environment with respect to our food. Obviously, we need to sanitize more than ever right now with the coronavirus, but that is, so actually getting fermented foods like the ones I listed, like tempeh, miso, yogurt, kefir, or sauerkraut. You can do vegan options as well. If you're going to do a probiotic supplement, and there have been studies, there were studies in pediatrics actually that have looked at multiple strains of probiotics supplementing during the cold and flu season, and reduction of cold and flu incidence, as well as school days absent from school and severity of symptoms. So I definitely recommend doing that. The other area where probiotics can be very useful is anytime you take an antibiotic of any kind, you should also be taking probiotics. And a tip about that is don't take your probiotic at the same time as the antibiotic. You want to take it at least 2 hours, if not 4 hours apart. Otherwise, the antibiotic will kill off the probiotic and it'll defeat the purpose. So probiotics are definitely useful. I would recommend at least 10 different strains if you're going to do one, and then look at eating fermented foods where you're going to get a variety of flora. But again, there's a whole, you can talk so much about it, and avoid things like aspartame, which are actually toxic to your microbiome, and also increase prebiotics or fiber, because fiber is the main food of your microbiome.
Okay, I have been doing that wrong for years now, so thank you for letting me know.
Okay.
If only I had known. Yeah, it's okay. That's a great tip. Wanted to find out your recommendation for good natural substitutes for sugar.
Mm-hmm.
Obviously it's nice to have something to sweeten up what you're eating, but we don't want to use aspartame, as you mentioned. So recommendations that you use?
The best is obviously to do whole fruits, right, which are naturally sweetened, but then they also have the fiber. That's why having whole oranges is better than having orange juice, because when you take out the fiber, you increase your blood sugar and you take out the protective effect of the fiber. So one of the exercises I have folks do is, how many oranges does it take to squeeze one full glass of orange juice, versus if you eat an orange, right, by itself, how many oranges can you eat at one sitting? That's because of the fiber. It causes distension in your stomach, sends a signal to brain, says that you're full, controls your portion size. So that's my number one recommendation. Then in terms of the hierarchy of sweeteners, if you are going to do it, stevia seems to be the best in terms of impact on blood sugar. And safer. In fact, there's been some studies with stevia sweetened drinks that also have vinegar in them in patients with diabetes and pre-diabetes, and it actually lowers your blood sugar and it doesn't have a negative impact. So I myself sometimes do use some stevia, but in general, I try to avoid that. And then in terms of the hierarchy of sweeteners, even maple syrup, raw maple syrup is a bit better than honey. I definitely would avoid agave. Agave raises your blood sugar and it really doesn't have as much of a benefit. So if you're gonna use something like that, I'd rather you use maple syrup, because it doesn't raise your blood sugar as much and it also has more prebiotics, especially if you get it in a grade B raw form.
Okay, great. That's a great tip. Wanted to find out, this is a great point that Kristen sent a note in. Many of us grew up on the food pyramid, which we found out later, according to Kristen here, was not based on science. So how do we make sure, you know, we're cooking for our families, that we are actually getting the best source of advice, you know, based on science to lead a healthy life?
In terms of resources, so where to get that advice, or? Yeah,
Yeah.
well, I think the University of Arizona Andrew Weil Center for Integrative Medicine has great resources. There's actually some of the resources and courses are actually free to the public in terms of nutrition. And I encourage everyone to look at that link. And then, you know, consulting, obviously, physician, particularly integrative medicine trained, because we get extensive training in nutrition, and we really use food as medicine in our practices. I think that one of the things that we already know is that the higher percentage of your diet is real food, right? That's unprocessed, and it's mostly coming from plants, right? In various forms. And when I say that, I'm not talking about eating a bunch of fake meat or mock meat, you know, which is processed plant food, right?
Mhm.
You really want to eat, and you can do that occasionally for a treat here and there, but really you want to actually eat the plants themselves, right? So the nuts, the seeds, the vegetables. I would say that from all the evidence that we know, if you can make 80% of more of your diet or more of your diet plant-based, then and eat the rainbow. Eat every single color of everything plant-based. And when I say eat the rainbow, I'm not talking about Skittles or the candies that are out there. I'm talking about actually eating the rainbow of real food, right? That's the problem, is that we see this fake food, what I call frankenfood, which really manipulates our taste buds and our palates, which the food industry has really used in much the same fashion as the tobacco industry has, unfortunately, where the foods are addictive. They don't provide any nutritional benefit, and they've contributed to the obesity and diabetes and heart disease epidemics that we're all suffering from. So eat real food and eat plants as much as possible, and avoid processed foods. If you don't understand an ingredient, if you can't pronounce an ingredient, that's probably not a real food, and you shouldn't be eating it. And eventually 5, 10, 20 years from now, we'll find out what negative impact that had on your health. Whereas we know already that plant-based, majority of your diet being plant-based is the best.
Okay, great, thank you. And now I'm going to allow Jayla to provide your question. Jayla, do you want to unmute yourself and then ask your question? Let's see if we can grab a question live here.
Okay, I think you need to unmute yourself. I think it's maybe it's Jale. Is it Jale?
This is Jale, and I have one question and I have a comment. So I'll ask the question first. I recently, the thought of reducing the sugar intake, I've always taken, been doing that for several years now. But I recently bought some xylitol to use instead of sugar. So there was, I know it's maybe 10 calories for 2 teaspoons or so, but I read a warning label. It says that you might be exposed to lead if you take, taking this product. Please give me some information regarding that, but I'm a biochemist, so I know that, the things that are involved in those. But why would it be sold then if it is going to be of danger to the consumer?
Great question, and thank you for your question. I think there's 2 responses to that. One is just in general about supplements as well as just food products, and even something as innocuous as candy. Like, right, we've found evidence that like children's candy produced from certain parts of the world have actually been laced with lead and arsenic and other chemicals. It's unfortunately a big problem with big food and just production, and how you know, companies are not acting ethically, or we don't have enough regulations in place. I'm not sure specifically about xylitol containing products and lead. I'm not aware of that in particular, but I know that there is unfortunately an issue of purity of standards. One of the things we learn about in terms of giving prescriptions for evidence-based supplements as integrative medicine physicians is looking to the companies that have more ethical practices, or that are using more regulated forms of supplements, like, you know, countries where they do regulate it. And that's one of the problems in the US, where they don't regulate supplements. So we really have to vet those companies. I think, and specifically about xylitol, xylitol wouldn't be my #1 non-nutritive sweetener. There have been studies, you know, they tout the benefits of it in terms of preventing dental caries and cavities sometimes in some xylitol containing gums. But it also has been implicated in irritable bowel syndrome. So people who have IBS or have sensitivity to that, which then to me also implies that it might have some effect on the microbiome that we're not aware of. So I would much rather you use something like stevia if you're going to use a non-nutritive sweetener rather than xylitol.
Great, thank you so much for that question. We are over our time, so I wanted to ask 2 rapid fire questions to you, Dr. Shad. Any comments on organic versus conventional produce?
Sure. I would look at the Environmental Working Group, which has looked at pesticide concentration and really follow their guidelines. They have something called the Dirty Dozen. They have another thing called the Clean 15 in terms of determining what to buy organic. The main consideration is pesticide concentration. It is true, though, that recent studies have also started to show that organic vegetables tend to have higher percentage of the nutrients than inorganic, although that we still don't know as much, and there's a lot of controversy around it. In general, I would focus on the Clean 15 and the Dirty Dozen, because it can be cost prohibitive. And that's another issue of our food policy, right? Because of the subsidies that we use that make fruits and vegetables, which we should be eating, more expensive, and a lot of the processed foods that we shouldn't be eating very cheap and widely available. And that's something that we need to inform ourselves about. That's something that came up in our discussion with the students and Senator Carter earlier this week, and we're going to continue to engage the community about.
Wonderful, thank you. And that question came to us from Spain, so that's exciting to say hello to our international participants.
Muchísimas gracias por su pregunta, y vamos a hacerlo en español también, este programa, si podemos. Gracias.
Yes, gracias.
We're going to do this in Spanish, I said, as well, if we can. So,
okay.
Sí.
Wonderful. Well, I did want to let our attendees know that we have logged all of the questions that we were not able to get to today. And so what we're going to do is we're going to tailor our email that we'll send out to you following this presentation to help address some of those questions that you submitted. And then also include Dr. Shad's contact information should you want to follow up for more information. But we thank you for your time today, for joining us for our very first Wellness Wednesdays. And we hope to have you back next week at noon to join us again. So have a wonderful, healthy day. And thank you so much to our presenter, Dr. Shad.
Thank you very much. Look forward to staying connected with everyone.
Yes, definitely. Thank you so much and have a great day.